Hospitals in the Valley still face a crisis. We're talking staff sickouts and a shortage of nurses. Nurses to patients say it's all overwhelming. The governor's office says it's finding solutions here.
Hospitals are desperate for nurses. Patients waiting in the waiting room for a couple days for a bed, and I felt for them.
Patients waiting. A single nurse caring for up to 10 people at once. Fox 5 has heard this desperate scenario in different hospitals across the valley over the past few weeks.
Then emergencies would have to either wait in the hallway or we'd have to move patients around, get their medications and oxygen and antibiotics in the waiting room.
One patient tells me, I was in the hospital for pancreatitis, 21 hours in the waiting room. It was a disaster. Or a sick nurse. I was sick with COVID and developed coughing fits when I talk. I've been off work with COVID for a month now. 3 nurses walked out and quit when they found out about the 10-to-1 patient to nurse ratio.
To see kind of a perfect storm where we're seeing an increase in patients, a bit of a surge in certain areas, at the same time when we're having our staff calling out. We're also canceling and rescheduling medically necessary non-emergent procedures.
The Nevada Hospital Association called upon the state for help. Governor Steve Sisolak asked several hundred nursing students to be apprentices, helping patients with basic feeding and bathing. Other states have called upon the National Guard. Nevada officials rule that out.
We have a very small National Guard. We only have about 4,000 National Guard members. We do not pull any medical personnel for National Guard active duty because we don't want to disrupt further those problems.
But the National Guard isn't the only solution and can't be the only solution. Nevada-born Medical Corps, we need you to serve